NHS here in Wales this winter. Have you or a family member needed an ambulance, maybe a trip to A&E recently? What was it like? What happened? Can you tell me about the pressures facing our paramedics, our emergency doctors and nurses? Call in. Dr. Amanda Farrow is the lead consultant for the emergency department at the Royal Glamorgan Hospital near Llantrisant.
I was actually called in yesterday morning early before my shift started to come and help. There was a number of members of staff that were in tears after the night shift. It was very difficult. They had some very sick and young patients as well. We had 2 calls for an immediate release where they're asking for us to immediately release an ambulance because there was an unwell baby and there was a lady in labour and they needed those ambulance transfers to happen.
That was Dr. Amanda Farrow. Well, in September, 85-year-old Keith Royals from Bodilwyddan had to wait 7 hours for an ambulance after falling and breaking his hip whilst cutting grass at home. Tina Royals is Keith's daughter.
By the time the ambulance arrived at 8:20 that evening, they were amazing, by the way. But he was then on the back of that ambulance waiting outside the hospital until the early hours. So the entire shift of that crew, who, by the way, had to travel 40 miles to get to him, and then the whole of their shift was spent with my dad. And the disturbing bit is that when they put him on the back of the ambulance, they called in to say we were coming across to the hospital, and they were told that they couldn't go into that hospital because it was full.
It's your reaction to what we've just heard, and it's your experience. Share your story, your experience with us this morning. 03700 100 110, text 81012, email dot@bbc.co.uk, tweet at BBC Radio Wales. Let me bring in Dr. Rob Perry now, Vice Chair of the Royal College of Emergency Medicine Wales. Bore da.
Rada.
It's quite difficult not to be frightened listening to the accounts we've already heard there in those clips. Can you share with us what is happening on the front line right now in terms of emergency services?
Well, it's very difficult, as I'm sure you can understand. I heard the comment from Amanda Farrow there, and I think what Amanda's saying is replicated up and down the country. I think all of us who work in emergency medicine have had similar experiences. It is very much a problem which is national, and that's the entire UK, not just Wales, and it is very, very difficult for all staff who are trying to maintain a service and trying to keep the patients safe.
OK, it seems to be getting worse. Is that how you're seeing it? Is this the worst it's ever been?
That's a difficult question. It's certainly probably the worst I've ever personally experienced, yes. That's purely on the basis of the fact that the degree of crowding in our emergency departments is more severe than I think it's ever been. The problem is that there's a lack of flow through our emergency departments, and it all really relates to a lack of flow through the hospital as a whole. It's difficult for hospitals to actually discharge people at the back end due to the problems with staffing and bed availability and social care. And that pressure goes right the way back through the system until you get to the emergency department, where we are unable to move people onto a ward when they finish their emergency treatment. Because we can't get people out of the department, that then means we can't bring new patients in from ambulances. And that's why we're seeing the ambulances having to wait outside the departments. And that has back pressure on the ambulance service, obviously. And that's why it's taking longer than it should to get ambulances to people in the community. It's all very difficult, and it's all deeply concerning to us.
Concerning, and what impact does it have on morale, on the staff at the front line?
It's awful in many cases. We have, in our emergency departments, we have a extremely dedicated and professional body of staff. I mean, nurses, healthcare assistants, doctors, porters, everyone, paramedics. Everybody wants to do the best job they can. Everybody wants to keep people safe. And it's becoming increasingly difficult to do that. And the people that are running our emergency departments are under increasing pressure, having to take very difficult decisions, as you heard earlier, and having to decide, right, okay, I've got one space in the department. Which of the 3 ambulances do I bring in at this point? And there's a degree of moral injury that impacts on these people. It's, you know, that you're unable to do the job to a standard that you feel is acceptable, and you're having to compromise, and that people find that very difficult. And the story that Amanda tells of finding staff in tears is not sadly unusual.
How on earth is this going to be fixed?
I wish I had an easy answer. We have, as representatives of the Royal College, we have spoken to the Health Minister at some length about this. I understand that her focus is on trying to fix the problems in social care. We very much welcome that. Because that is, as I say, it's a lack of flow through the hospital system, which is at the basis of this. I sometimes describe this as being like a bathtub. If your hospital is a bathtub, if you do not remove the plug, then your bathtub is going to overflow. If you have a bigger bathtub, it'll take longer to do it, but eventually it will overflow. And the only way to stop that from happening is to actually drain it. So I think that is where the main focus of the problem is. But unfortunately, those of us who are working in the system don't have the tools to actually change that. And so all we can do is try everything we can to try and keep the situation as safe as possible. That, as I say, is increasingly difficult, but I can reassure everyone that we are trying our absolute hardest to do that.
Thank you so much for coming on the programme this morning. That was Dr. Rob Perry, Vice Chair of the Royal College of Emergency Medicine Wales, and I know you are going to want to respond to what was said there.